As we age, we notice that many a times women start noticing the midline in the hair starting to part, and this partition is now starting to widen. This is called the female pattern hair loss, and it's due to oversensitivity to the male hormone androgen. If you're not the one who looks at surgical options for your hair thinning and hair loss, there are many non-surgical hair treatments that are available, starting with topical serums. There are certain other treatments that can be used in clinic. These treatments include PRP and GFCs and these plasma-rich fibrins which are injected into the skin. But the latest is regenerative medicine. There are certain light therapies and laser lights that can be used, especially the red light, which stimulates the hair follicles and reduces inflammation. And last but not the least are home care treatments. A gentle massage with active rosemary oil or other ingredients like ginseng or saw palmetto, which is present in certain oils, can help stimulate the blood supply to the scalp and can help improve the hair quality, the hair density, and also help repair scalp conditions. Hi, my name is Dr.Amee Daxini. Hair thinning in women can be multifactorial, ranging from a genetic predisposition to nutritional factors to stress to lifestyle choices. Let us look at certain conditions where we notice thinning. The first is hormonal changes in our body. It could be imbalance or it could be natural changes. As we age, we notice that many a times women start noticing the midline in the hair starting to part, and this partition is now starting to widen. This is called the female pattern hair loss, and it's due to oversensitivity to the male hormone androgen. The second type of hormonal changes that we see in hair is generally postpartum or after a delivery, because that's when there are hormonal changes in the body which cause all the hair go to the shedding phase, and that starts shedding. But the good news here is that this is reversible. The next comes during menopause. Menopause again is the time when the estrogen starts reducing in a female body. If you're not the one who looks at surgical options for your hair thinning and hair loss, there are many non-surgical hair treatments that are available, starting with topical serums. These serums just could be nutritional serums which add the protein or peptide to the scalp in the form of copper peptides, or they could be active ingredients like minoxidil, especially in the female pattern alopecia. Minoxidil helps improve the blood supply to the scalp and keeps the hair follicles growing, reducing the miniaturization or thinning of the hair. Certain other serums which reduce the effect of the androgen hormone on the hair follicle are very effective. We now have an active ingredient in 1 to 3%. It can help target the stem cells of the hair follicles, making them more viable to hair growth and making them stronger. This will also reduce hair thinning and shedding. There are certain oral medications also that can be given. To start with, oral minoxidil. When minoxidil cannot be applied topically or one does not want to use it topically, oral minoxidil in a low form can help in improving the thickening of hair. You have certain medications like spironolactone as well as metformin, which are generally used when hormonal hair loss is the cause. There are certain other treatments that can be used in clinic. These treatments include PRP and GFCs and these plasma-rich fibrins which are injected into the skin. But the latest is regenerative medicine. Here we inject stem cells or exosomes, which are specific vesicles that contain the active ingredients that help hair rejuvenation. These are used either injected directly into the scalp or via microneedling. Research still needs to give us its efficacy, but the initial studies show excellent results. There are certain light therapies and laser lights that can be used, especially the red light, which stimulates the hair follicles and reduces inflammation. And last but not the least are home care treatments. A gentle massage with active rosemary oil or other ingredients like ginseng or saw palmetto, which is present in certain oils, can help stimulate the blood supply to the scalp and can help improve the hair quality, the hair density, and also help repair scalp conditions. So there are a lot of treatments available when you notice hair thinning. By trying these few over-the-counter and home care products, I hope you see good results. Certain things you need to remember when you do this. The first is consistency. Since hair is a very slow growing organ, it's important that you keep using these products at least 3 to 6 months before you decide they are not for you. The second thing is using the ideal amount. Many a times if we underuse the amount that is prescribed, it may not give us the results that we are looking for. And at times if we use excess, it might irritate the scalp and cause more hair shedding. It's important to remember that beyond this, if the hair loss doesn't stop, it is time to meet a professional, to consult your dermatologist, try and understand the actual cause of hair loss and get the right personalized treatment.